Well, welcome everyone. I appreciate all of those of you who are here today and have taken some time from your obviously very busy schedule to be with us on this kickoff campaign that we're going to talk about today. So I want to welcome you to our Kerman site. My name is Margarita Rocha. I'm the Executive Director for Centro La Familia Advocacy Services. Our site director, Angelica Perez, please come forward. So pásate para acá, por favor. I just want to make sure everybody knows that Angelica Perez is our site director for the Kerman site. And we also have my deputy director, Mario Gonzalez. Thank you. And some of our other staff is here, and our site staff is here. Thank you. We really appreciate this opportunity to be able to bring in additional services to the Kerman site. We are a neighborhood resource center that serves families and individuals throughout Fresno County. We have offices in Fresno, Kerman, and Highway City. And we are very blessed to be able to have these three sites, and we thank the Department of Social Services for giving us that opportunity. Our organization was founded in 1972. And we provide direct advocacy and intervention services to more than 10,000 families annually who we help in accessing programs such as parenting education through First Five. Thank you so much, First Five. We have assistance with enrollment into CalFresh and health insurance, Department of Social Service partnership. Services for victims of crime that include domestic violence, sexual assault, and human trafficking. And we are fortunate to be funded by many different streams from federal level to local level. We also do immigration services, and part of our work includes DACA services, which are critically important in today's time. We do mental health support groups and linkages to other needed services. This is but a brief overview of what we do. Through these services, though, we come face to face with the most dire needs of families. We get to see where the families are or are not. And all of us in this room, I believe, are the people who are the advocates to help our families' lives and children's better. So through these services, we also work to empower a network, of which I just spoke of, because we cannot do this work alone. And I always believe that. I don't believe that we work in a vacuum. One of the many basic needs for low-income families with children is diaper needs. And I can tell you that for years, I have been looking for a program that could assist us with the diaper needs of our families. Because I have seen what happens to children when parents don't change their diapers. And it's not because they don't want to, is they don't have them. And so they leave the diapers on longer, and I've worked with families directly that I've seen this happen. So this program will help us to keep these babies clean, dry, and healthy. We've got Dr. Arambula here, who certainly can speak to the health and needs of small children and what parents sacrifice when they don't have the resources for these children. So to address this need, the First Five Diaper Kit Program will provide diapers, baby wipes, and other essential items to hundreds of low-income parents with children 0 to 3. I think that deserves an applause. But they've gone further because, well, I think of diapers as a critical necessity, which we all know. Incorporated into that is also the First Five Talk, Read, Sing campaign that addresses the early learning gaps faced by the young children in low-income families. And I can tell you that as a young parent, when I was a young parent, I had no clue. But this kind of program helps us help the parents understand that so many things all have to go together. It exemplifies the tremendous potential of a supply bank model to address unmet needs, material needs. We're excited to be part of this project that will provide the much needed assistance to the families we serve. And most of you who do know me, you know that I am always searching for other ways to help our families. So I am really proud to be part of this program and that our organization has been selected. Thank you.
Well, thank you very much for hosting this event today, and I just want to, well, my name is Benito Delgado-Olson. I'm the director of SupplyBank.org. I have the privilege of being able to introduce many of today's very esteemed local and distinguished speakers. But before I do, I just wanted to really thank Centro La Familia Family Services. They have made facilitating and expanding this program into Fresno County a very easy and fun thing to do. And likewise, I also want to thank First Five Fresno County. I don't want to take away the other talking points, so I'm not going to talk too much about the program, but I will say that my mother grew up very low income, and she used to come to the park just down the street to picnic with her family, and she grew up in North Fork and ran the Puente program, which had a lot of low-income parents in it at a community college for 40 years, and so it's just very exciting for me personally to be able to work with such great local leadership to expand this program into Fresno County. But I wanted to also just thank and recognize First Five California, Kaiser Permanente, Sunlight Giving, and the other host of partners that have worked with us to expand this program into 14 counties throughout the state. Our first speaker for today is the chair of the First Five Fresno County Commission. I've come to know through working with many of his colleagues at the First Five Fresno Commission as well as elsewhere in the county. Just has a reputation for excellent leadership in providing critical services to low-income children and families. So it's my pleasure to introduce Supervisor Brian Pacheco.
Thank you, and joining me today is our Executive Director, Emilia Reyes. Come on, Emilia, get up in here. Yeah, she does all the real work, and I get a lot of the credit, so I want to be grateful to her and be honest about that. So I want to thank you for being here today, and I'm really grateful to be a part of First Five when we can do things that help our most needy families. And I can remember when my children were babies, and surprised me not only at the cost of diapers, but how quickly that we would go through them. But I guess it's pretty simple. You feed them, and well, then you know the rest. Yeah. But for some Fresno County families with young children, having enough money left to buy diapers is a very serious problem. And for each child, it costs about $75 a month for diapers. And for a family in rural areas, it can be much higher. Well, we're fortunate here in Kerman, but many rural communities don't have the big box stores. So families, it just costs more. Families can't take their child to a child care center without supplying diapers either. So that's another burden that they face in today's society. And that's why I'm really proud that First Five Fresno County is partnering with the Supply Bank. And through this program, 55 pre-designated families will get a diaper kit containing 100 diapers and 200 wipes every month. And that's just fantastic. And there were 55 families selected from our community around Kerman and Mendocino, but also from around the Huron and Coalinga, Selma, Reedley, Sanger, and the Parlier areas too. So you can tell this program is widespread throughout Fresno County. And for each of the families that we assist over the next 6 months, we'll reduce the risk of children requiring treatment for severe rashes and conditions stemming from their families not having enough diapers, as Margarita expressed earlier. And it's funny, it's an interesting statistic that in 2017 in Fresno County, more than 1,500 emergency room visits were related to these issues. And I just found that to be amazing when I was told about that. And at about $2,000 per emergency visit, you can see the real cost of the diaper need, and that was really amounted to about $3 million in 2017 alone. So if we can prevent just a few families from visiting an emergency room, which could result in other illnesses too, then this program will be a success. Again, I want to thank First Five and Centro La Familia for sponsoring this event, and the Supply Bank for its effort in making it a better life for all of the people in our community. Thank you.
No. You said it all.
Okay.
Thank you.
Well, next, it's my pleasure to introduce a representative from Kaiser Permanente. There were really two initial seed partners for SupplyBank.org that made this happen. One was First Five California and their wonderful Talk, Read, Sing campaign. And the other was Kaiser Permanente. And that story that I'll just share is their CEO saw something on MSNBC because the the United States House of Representatives had a hearing that amounted into a bill that's ongoing now with our local congresswoman around diaper need. And that prompted him, SupplyBank.org being housed in Oakland, to really encourage local nonprofits to look for innovative solutions that could be scalable to address diaper need. And so we're tremendously grateful to Kaiser Permanente for their support of this program, not just in Fresno County, but throughout Northern California and beyond. And it's my pleasure to introduce Selena Mendoza from Kaiser Permanente.
Hi, everybody. So I just want to say thank you for inviting us today. As Benito mentioned, we're really excited to join this campaign. Kaiser Permanente was able to give $50,000 for this campaign, and it's part of a larger contribution. So last year it was $1.5 million that we gave for SupplyBank to open their distribution center, and so that's been really exciting for us. But of course, just like everybody said, with approximately 4,000 hospital visits due to diaper need per year, several studies correlating diaper need to poor mental health in parents, this is really a key in the investment of our communities. And so, we're just really excited to be a partner. That's it. Thank you.
Forgive me, I didn't check to see, is Delfino here? Oh, perfect, I just see you, sorry. And guess who I'm introducing next? No, I heard from Centro La Familia just how wonderful of a partner Fresno County Social Services has been to grow this wonderful nonprofit organization throughout rural communities in Fresno County. And it's very much my pleasure to introduce Delfino, the Director of Fresno County Social Services.
Thank you and welcome to Fresno. First, I want to thank one of my bosses, Supervisor Pacheco, for his support in our vision at the department that we should expand services to all the communities in the county. It was a vision that the department had 4 years ago, and now you see 11 vibrant neighborhood resource centers, and we're looking to expand. And we believe philosophically that the solutions are best done by local communities and by the local people there, and it's our role as a government to supply that support. So this facility here is just a demonstration of things that are happening throughout the county in support of that. I want to thank First Five because they were our first official partner outside the county to jump in with this on that and to continue that work. And I think today is sort of the next layer or the next vision of how these NRCs work, because this is a natural fit for working in the community. This need has been a long-term need in our community. For those of you who don't know, I've been in social services for 30 years. About 20 years ago, my assignment was to run the emergency shelter for children in Kern County. And at the shelter, when I got there, I found out that our staff was going out to the supermarkets and stores and asking for diaper donations because the county didn't have a diaper budget. And we'd get diaper donations to have for the kids that came in, but also for the kids, the starting kids, to go to their foster homes. And then my boss said, you can't have staff do that. So I said, okay, staff, you can't do that. I'll go do that. So I used to go to Save Mart, I used to go to Kmart, Food Max, and ask for the packages of the ripped diapers, and they would donate them to us, and then we make kits up for the kids that were coming into custody and going out to foster homes. And I think one of the sort of the benchmark accomplishments I had at the county at the time was I got the county degree that we should have a budget item for diapers. But that was a big shift in philosophy for, that is a basic need that we needed to have. This is another example of that. This is a great nexus because I fully support this vision. 7 years ago, I did a talk on Radio Bilingüe to parents and to the Mixteco community, and the topic was how to avoid being reported to CPS, right? And I said, I don't want to talk to you how to avoid being reported to CPS. I want to talk to you about how to be a good parent. Read to your kids, talk to your kids, read to your kids every night when you get home from work. If you do that every night, then you'll never be reported to CPS. You'll have a healthy, thriving family. And then the host, the DJ said, and you won't be in the bars. I go, that's the other thing. You won't be in the bars with your kids every night. And you'll have more money because you're home reading to your kids every night. And your kids will be successful in school, right? And we know that if they're successful by 3rd grade, they're going to be successful in life. So if you do that every night, and my whole 2 days, I did 2 separate Sundays with them, was just on that. I didn't want to talk about the bad things that can happen. I talked to them just about the good things that they can do for their kids. And this is in support of that. This initiative is in support of that. It's in support of having healthy kids, healthy families, healthy communities. So I appreciate the partnership. I appreciate all of our partners. I think 4 years ago I told some community folks, we don't need vendors, we need partners. We need partnerships. And this is, we believe, the next step in that development. So thank you.
Thank you very much, Director. Next, it's very much my pleasure to introduce the Executive Director of First 5 California. First 5 California, of course, is the state version of our Children and Family Commissions that we have in every county across the state. But more than that, they've really been a thought partner and a thought leader for this whole initiative since we started it a few years ago. Working with Kaiser and other members of the philanthropic community in the Bay Area, and have really been a key partner in bringing this vision to other communities across the state. So it's very much my pleasure to introduce Camille Maben.
Good morning, and thank you, Benito. It is such a pleasure. This is like one of the best parts of the job, when you get to come to communities and really witness firsthand the partnerships that you all work every day to ensure that children, young children and families have the very best that they can have and thrive. Thank you, Assemblymember Arambula, for being here and for all the work you do on behalf of the children, not only of your constituency, but around the state. So grateful. And most of all, I just have to say, and I was thinking about it, and we were kind of talking about it on the way down, I need to say thank you to my good friend Benito, right over here. You know, I met him, he looks so young now, but I met him when he was even younger a few years ago. And I knew from that very first meeting that he was going places. And he was going places to do the very right thing on behalf of families in California who have needs that we can meet. So SupplyBank.org is one of our good partners, and we are so appreciative of the work that you do, sir. So I just wanted to, say that firsthand. So with that, just to say so much how, for us at First 5 California, we really look at how best to partner with our county partners, Emilia Reyes at First 5 Fresno and her staff that work so hard to really implement the programs that we together believe are really going to move families forward. The Diaper Kit Program, was launched in 6 counties originally to provide, as we've said, diapers and wipes and other essential items. We're always thinking about what else can go in the box to really help low-income parents and families with children 0 to 3. Through 17 partnering First 5 supported family resource centers and women, infants, and children, the WIC clinics. So we really worked with them initially, and we saw the success that it had in counties. You've heard it from previous speakers. Less trips to the emergency room, healthier babies, parents who have one less worry as they go through their day, knowing that their children are being served and kept dry, and all the important things that happen when you have diapers. And so Benito and SupplyBank.org did a great job of really putting together that story for us. So it was an easy ask to our commission, and easy for them to agree to expand that to several other counties, including Fresno. So as Benito said, we're now in 13 different counties, and it is an amazing program to watch grow. Part of what we all said was because we are pretty connected to Talk, Read, Sing and to our friends the birds. How do we get that message across to parents in a really fun way and a gentle reminder every time you go to change a baby's diaper? So we designed the box with Benito and his staff to really make sure the birds were there and the message was clear. So we're excited. It's like a win-win. You know, message is delivered and diapers are there as well. So we really think it is a little bit of a match made in heaven. So we're excited about that. We're excited about watching what happens in Fresno, and as we continue to look at serving the children and families, not only in Fresno County, but across the state in a need that is great and with something that is essential. So thank you so much, sir, and thank you all for being here today, and especially thank you to Centro La Familia for hosting and the work you are going to be doing in the future, and the work you do now. Okay.
Thank you, Camille, and I should also just take a minute to recognize the two members of my team who are here, Justin Van Zerber and Erica Sweeting. I'm not a one-man show by any means. My staff all work just as hard as I do and are a big part of why we can do this in many counties across the state. One of the only other things I would add that just builds on what Camille was saying is that we've read studies that actually show that diaper time, when you change your baby's diaper, is one of the moments where their concentration is the most fixed on the parent or the caregiver that is changing them, which is why the linkage between talk, read, sing, and diaper time as talk time is such a good one, because it's a moment in time where your baby is really focused on the face of the person that's changing their diaper. Our last speaker, who I have the pleasure of introducing, probably understands this at a higher level, I would dare to say, than most members of our state legislature, because he's also a physician. And would probably understand all the technical words for diaper rash and UTI and so forth better than most folks that we talk to. But I will say it is a pleasure, not just through his own leadership, but reflected in his staff at the district level in Sacramento as well, who really understand the medical consequences of something like diaper need at a much higher level than your average individual that we might find in your same position. Diaper needs linkages to all types of wellness and health are quite severe. And it's a pleasure to have someone as respected and as strong of a leader as Assemblymember Arambula. So let's welcome him.
So I have to start by actually thanking Margarita Rocha and Centro La Familia, who got an award this past week. And what an honor it is when you have a pillar of our community helping to be both a trusted messenger, but also a trusted voice for our community. It's nice that we're out here in the rural parts of our county, making sure that we provide access to everyone within our community, not just those who live in our urban centers. But today we're here to talk about diapers, and it's something I know a thing or two about, having 3 young children myself. And I was quite aware of how expensive diapers were and how quickly we go through them. Having practiced in an emergency room for a decade, I also saw my fair share of visits to come to the emergency room to help treat what is a preventable cause. There are 40,000 ER visits in the state of California each year for diaper-related illnesses. 80% of those are treated in an emergency department. We heard the stat earlier today. That's 1,500 visits in Fresno County alone. Those are things that we can do to better support our working families, to help them to make ends meet. And that's why I'm pleased to come here to support First 5, to support Kaiser, to support SupplyBank.org, but also to recognize that the state of California has some responsibility to ensure that those of us who have needs are meeting those needs as well. I was helpful in advocating for some funds at the state level to ensure that Fresno County will get $2.5 million that will help to support our Fresno Food Bank to make more diapers available as well. I look forward to opportunities that we will have to partner with groups who are those trusted messengers, who are that trusted voice in our communities, to help to distribute more diapers in our communities. For we have the kids, and it's time for us to ensure that they get the education and that they have the opportunities. The only way we can do that is by supporting our children, ensuring that they're clean and they're healthy. So I thank everyone who comes here today, and that I got to play some small role in this as well. Today is a glorious day, that we get to advocate, that we get to help, and that our kids will have a healthier future. Thank you for having me.
And before we conclude, I really wanted to thank again First 5 Fresno County, not just Emilia, but her colleagues Cindy and Karen, as well as Lupe Jaime from the County Office of Education that helped bring this to Fresno when we first talked about it maybe 2 years ago. And then also just to close on a note that I left out about SupplyBank.org. Our vision is really to be like a food bank, but for things that are not food. And so what we do goes well beyond diapers and wipes, and as Camille hinted soon, diaper cream. But stationery, hygiene, feminine hygiene, disaster relief supplies that are stored so when Cal OES needs them, they're there. Those are all things that we seek to do. And the food banks, what we told them when we had the honor of presenting at their last membership meeting a couple months ago, was that their model and their successes actually gives us a lot of confidence that something like this can exist for unmet material needs across the state. And not just working with them, but the other nonprofit diaper banks that exist in California, one of the things we're talking to Kaiser about is a referral system. So there are 40,000 hospital visits. Well, what if every baby who went to the ER because of a severe diaper rash or urinary tract infection then got a referral to an organization like Centro La Familia Family Services and was guaranteed to have enough diapers until that baby was potty trained and didn't need them anymore. This is step one. That's step two, to make sure that some of the most dire consequences of diaper need can be addressed, and that's all part of the vision of SupplyBank.org. And so once again, we're very grateful. It's First 5 Fresno, First 5 California, Kaiser, Supervisor Pacheco, Assemblymember Arambula, Delfino, our Director of Social Services, and everyone today for your time and support. And just thank you all again for being here.
Thank you.
Yeah. Nice job. Margarita.